Good morning. My name is Tammy Ng, and I am a second-year undergraduate here at UC Davis. I am also a coordinator of pre-medical programming for the 12th annual UCD PHSA Pre-Health and Pre-Medical Professions National Conference. I would like to thank the AAMC for sponsoring this event. Today, it is my honor to introduce our next keynote speaker, Dr. Richard Thorp. Dr. Thorp is the president of the California Medical Association and has served as a leader in the association since 1995. Dr. Thorp is an active community member in Paradise, California, where he has practiced internal medicine for very many years and is the CEO of Paradise Medical Group. His passion for health policy and health system reform is manifested in his service as a rural health clinic medical director. Dr. Thorp's outstanding achievement in internal medicine has been endorsed by the American College of Physicians, which has recognized him as a fellow. As a committee member, he has also served the American College of Physicians at the national level. And so, without further ado, please welcome Dr. Richard Thorp.
Good morning. It's a very great honor for me to be here today, and I want to just take a minute to tell you how much I really believe in what you're doing. You know, so I'm a family primary care doc in Northern California, about 90 miles north of here, up in the Sierra foothills, and I've been doing this for a number of years, as they said. I think what has really come to me over the last several years is realizing how important the next generation of healthcare professionals is, and I think the motto of this gathering, the empowering the future of healthcare professionals, really speaks to that. For thousands of years, the profession of medicine was basically rudimentary. There was very little that we could do for patients. But at the very beginning, Hippocrates, in his initial understanding of medicine and the workings of the body, made it clear that above all, we should treat patients as our family, that we should keep their information private, and that we should put ourselves second to what our patients' needs are. And through the history of medicine, those principles, the importance of the patient-physician relationship, have continued to evolve and strengthen. Now, I say that because this is at a time when the technology of medicine seems so overwhelming. Each one of you have multiple ways of accessing thousands, hundreds of thousands of documents and images and videos of the ways to do things and information about things. But I think it's really important as you start facing the future of your healthcare future that you don't just think about the technology, but that you recognize that every time you interact with a person, that you have the ability to create a special connection. And it's that connection that's as healing in many ways as all of the technology and all the things we do to people. For thousands of years, what really happened in medicine was very limited. Most of the time, you sat at the side of the bed hoping that the fever would break or that the plague would pass. Very similar to what we face today with the Ebola virus. There's very little that we can do to actually treat the Ebola virus. Very little that could be done back in the days of the plague. Very little that could have been done many years ago with tuberculosis. But what the importance was of the physician and those people around him was that he actually sat there, had the bravery and courage to go into those difficult places and stand back to back with those patients and support them and care for them. For years, we built a knowledge base with Aristotle understanding anatomy and Galen understanding physiology and going through the history of all of the giants that we stand on today. But you know, it wasn't until about 100 years ago that we actually were able to do things that actually help patients. And the first thing that was done really was the discovery of anesthesia. About 100 years ago, anesthesia was discovered, and it was at that point that you could actually do surgery, remove somebody's leg that had been injured in battle without the risk of death because of the amount of pain. We didn't even have antibiotics really at that point. A few years later, antibiotics began to be developed. And with the addition of antibiotics, the prospect of being actually able to intervene and do something for patients significantly improved. You didn't just have to sit by and wait for the disease to run its course. You didn't just have to wait for the ultimate outcome, whether it was death or being maimed or being crippled. Over the last 35 years, since I left my training program in internal medicine, the practice of medicine has dramatically changed. And even then, in 1981, when I finished my residency, I really thought I was a pretty smart guy. I thought I knew quite a bit about medicine. I thought that the tools I had available were really good and that we could do a lot of things to make a difference in medicine. Over the last 33 years, since I've been practicing in a little town called Paradise, north of Sacramento here, I've realized that the whole practice of medicine has changed. When I left my residency program, the most common surgery was basically an open surgery. You had to open the abdomen, make a large incision to take out the gallbladder. The second most common surgery was a large incision to remove part of the stomach to prevent or treat ulcer disease. We don't even do those surgeries. I shouldn't say we don't do them, but they're so rare today because of the advances that have been made in surgical techniques, specifically with laparoscopic surgery, looking through an instrument to be able to look into the abdomen and to be able to do surgery with instruments that actually is able to remove the gallbladder. Today, back in the day when I was a resident, it took about 10 days to recover from a surgery for your gallbladder. Today, you go in, have the surgery done, and many people go home that same day because the surgical intervention in terms of violating the abdominal wall is so much less traumatic. But that's just one example of the kind of things that have changed in that last 33 years, those last 35 years. Not only that, but you have all of the unusual imaging techniques. The MRI wasn't even being considered back then. CT scans were just being developed. Ultrasound was just in its infancy. And all of those have matured over the last 35 years to the point that today, if you are fortunate to be able to enter medical school, you'll have a handheld ultrasound unit that you actually do bedside ultrasound, where you actually look at people's hearts with the ultrasound machine. You don't have to, there's some benefit for a stethoscope as well, but you still have the ability to do that with just at the bedside. But all of that technical importance, all the things that we do technically to patients, has value only in the sense that when you interface with another human being, you have this unusual ability. And there's something about that the profession of medicine has brought to you. It's this history of people trusting that you're going to do the right thing, as Hippocrates said, that you're going to put yourself second to the needs of the patient, that you're going to sacrifice yourself to make sure that what needs to happen will be done for that individual. So you might ask, well, why am I, as president of the California Medical Association, why am I here with all of this sort of background information? What is the point of the California Medical Association, and why are we here to be speaking to you as young healthcare professionals looking forward to your life? First of all, we believe in this profession. We believe in the future of this profession. But we also understand that there are many forces out there that will want to shape the future of your profession. A future that has great potential, but also a future that is potentially fraught with problems. As you know, we've expanded the access to health care in the last couple of years with the Affordable Care Act. What an incredible thing that is. that now we have millions of people who have access to health care that didn't have it before, people who can actually have access to contraceptives, to women's health, to infectious disease care, to the ability to get intervention when they need it, at the time when they need it. But it's also important to recognize that without advocacy, without someone who actually understands the complexity of the healthcare system, without someone who actually understands what the future of, and has a vision for the future of what healthcare can and should be, if there's not someone leading that discussion, if there's not someone focusing on the future of your profession, things happen that are unintended. It's important that you have a vision. Personally, it's important also that the profession have a vision as well. So today, the California Medical Association is building a vision of the future of what California medicine will be in the next 10 to 15 years. A future where the integration of the electronic health record will actually bring information to the point of service where when you're actually taking care of a patient, you'll be the most well-prepared person to make the decision about what needs to be done for that person. It will mean that medicine can be done efficiently. We're facing this incredible challenge of how do we provide health care to millions of people that didn't have health care before for less money, because the costs of health care have dramatically risen over the last 30 years as well. We have all this technology, but how do we use it the most effectively? How do we make sure that we're using it for the right people in the right place at the right time? This is the future that you're facing. This is the future, the exciting and incredible future that I believe each one of you face as you look forward to a profession in healthcare. I look forward to the changes that I just mentioned, these changes in imaging, changes in surgical techniques, changes in medications, changes in other treatments that have advanced the practice of medicine and healthcare delivery over the last 33 years. And the truth is, in that 33 years, there's been a huge increase in the amount of care that we can actually give to patients compared to the 30 years before that. But I believe in the next 15 years, because of the changes in genomics, because of the advances in other imaging techniques, because of the advances in treatment of cancer, the advancement in the treatments of aging and Alzheimer's, the challenges of the current epidemic of Ebola, all of these challenges are going to create the incentives for young professionals like yourselves to transform the future of healthcare even more than I've seen in the last 33 years. California Medical Association has a vision for the future. That vision is, as I said earlier, to make healthcare delivery more efficient, to make sure that yourself at the point of service, that you have the tools necessary to make the decisions that you need to make, that the effective delivery and financing of healthcare is efficient and that it's well thought out. And so as a part of that vision, we have a very strong place, a very important place that we put students, residents, and fellows in the organization. We have medical students who serve on our Board of Trustees and in the House of Delegates as delegates. We also have residents and fellows who serve on the Board of Trustees and at the House of Delegates as well, who help make the policy for the California Medical Association. We believe that the young people in the future are the future of medicine, and we embrace each one of you as potential healthcare partners in the future, and hope that you will see us as one of your partners as we move forward. This year, in December, the House of Delegates will meet, which will create policy for the CMA House of Delegates, or for the California Medical Association, and we'll have students and residents and fellows there who help in an integral way help create policy for the organization. This policy is important because it becomes the future for legislative and regulatory advocacy that actually shapes what happens for the future of medicine in California. This year, a UCSF student, submitted a bill for limiting the use of sweetened beverages, SB 1000, that was carried by Senator Bill Monning. The UCSF student came to the Capitol and testified before committees, testified before various legislative hearings, and was very intricately involved in helping to create that policy and create that legislation. That's just one example of how we want to include students and the young people in the profession as we move forward to make sure that healthcare in California is not only integrated, but is also shaping towards the future of healthcare. We also have a number of other educational efforts that we provide for students and residents and fellows. The Western Healthcare Leadership Conference will be this next spring in Hollywood, and we'll also have additional opportunities at the American Medical Association, where we bring California students to the American Medical Association to help with national healthcare policy as well. I think the thing that's important to recognize is that all of the good things that happen in healthcare are influenced by the political environment we're in. Herodotus, back in the 4th century BC, said, "You may not want to have anything to do with politics, but politics will have something to do with you." That's a very important concept, because even though we may not, and I certainly didn't feel like I was a politician when I left my residency training program, but today, in my practice, politics, legislative activity, regulation has as much to do with what I do on a day-to-day basis for my patients, and provides sometimes obstacles for that more than, or as much anyway, as what I learned in medical school. So it's important for you to be engaged, it's important for you to be advocates, and it's important for you to not only have a vision for your own future, but to also look to the future of healthcare and help to create that vision as we move forward. I want to thank you, each one, for your interest in and your dedication to the practice or to the healthcare delivery system. Whatever we can do to be of benefit to you, please let me know. Thank you very much for your time this morning.